Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and the question today is, should general dentists who do ortho on clefting patients? And my answer is totally 100% no. Refer that patient out. You can refer to your local orthodontist. Your local orthodontist may or may not have experience with clefting patients and may choose to refer the patient to a cranial facial clinic, which is personally my preference. Most major dental schools or major children's hospitals do have a craniofacial team. There's usually an orthodontist on that team. Usually all their needs are supervised by this team because it's way more than just straightening teeth. It's also going to be speech. It's going to be occupational therapy as needed. There's a lot, in ENT, there's a lot that goes on. Now, they're not always going to look like this when they come into your office. Usually the clefts, unless they're coming from a foreign country and they haven't had a proper repair, usually by the time they make it to your office at age 8, 9, 10, 11, they're going to be fully repaired. They're not going to have a defect. What you often will see is you'll see either a funny looking ridge or you'll see some missing teeth, usually in the front, which to me is a dead giveaway. And usually they also have an underdeveloped vaulted palate. So whenever I see a patient with a steep palate who's missing a few teeth, maybe with a longer face or a slightly different airway, I'm thinking, did this patient have a cleft repair surgery or even just a lip repair surgery? Lips only, I don't have a huge issue with. Only thing is that it tends to be tighter in the premaxilla area, and so you tend to still have more of a class 3. And unless you know how to treat class 3s, growing class 3s, probably should refer that patient out. But palates, for sure, no, because when there's that bone graft, bone repair, teeth don't move properly through them, if they move at all. And you're going to be really surprised at how difficult, and you're probably not going to be able to get what you need to get. And very commonly, parents don't write it down on the medical history that they've had cleft repair surgery, which is kind of a surprise to me. But I've had it happen enough times where I'm looking at a patient, I'm looking at the medical history, I'm looking at a patient, and I'm like, did you happen to have cleft palate? And they're like, oh yeah, oops, we didn't know it was important. The surgery's already done. Well, yeah, it is, because teeth don't move normally, if at all. So I can't just do normal ortho on you. So yeah, it's a big deal. I need to know these things. So, from time to time, again, one of my GP clients will submit a case to me and I'm like, I think this is a cleft patient. Can you ask? So anyways, that's why this came up. All right, thanks so much.